Fitting the contraceptive implant. A contraceptive implant is a small flexible plastic rod which is the size of a matchstick. It's placed under the skin in your upper arm by a doctor or nurse and is unnoticeable once fitted into the arm. The implant steadily releases the hormone progestogen into your bloodstream. This pauses ovulation, which is the release of an egg each month and is 99% effective at preventing pregnancy. You can have the implant put in at any time during your menstrual cycle, as long as you're not pregnant. Before the procedure, you can speak to your nurse or doctor to discuss any concerns you may have. To fit the implant, the doctor or nurse will use a local anaesthetic to numb the area on the inside of your upper arm. They will then insert the implant under your skin. The whole procedure only takes a few minutes from start to finish, and the actual insertion only takes a few seconds. You can ask to stop at any point during the procedure. You may also want to take painkillers such as paracetamol after the procedure. The implant insertion site will be covered with some tape and a dressing, which are also known as steri-strips or paper stitches, so you won't need any stitches afterwards. You may notice some bruising, tenderness or swelling around the implant site when it's first put in. This is perfectly normal and usually gets better on its own. In rare cases, the area of skin where the implant has been fitted can become infected. Signs of infection could include redness, pain, swelling, skin feeling hot to touch or a higher temperature. In which case, speak to your GP, a pharmacist or a sexual health clinic for advice. If you use an implant, you may experience changes to your period. For example, your bleeding pattern may change. It can vary from being lighter and less frequent to heavier and more frequent, or staying the same as your usual periods. If you have any concerns, speak to your GP or other healthcare professionals. Once inserted, it can take up to 7 days for the implant to become effective and before you can rely on it for contraception. Depending on where you are in your cycle or what contraception you were on before, speak to the doctor or nurse fitting the implant for more information. The implant works for 3 years before it needs to be replaced. A specially trained doctor or nurse can remove it at any time if this method is not right for you or if you want to start trying to get pregnant. Speak to your GP or practice nurse to see if this method of contraception is suitable for you, or you can visit your nearest sexual health clinic for more information and to discuss your options. To find out where you can have a contraceptive implant fitted, click this link.